Undergoing circumcision, whether for medical reason, cultural reason, or personal reasons, proper aftercare is very important in order to ensure smooth healing and avoid complication. It's not just about the procedure. The procedure is just for few minutes. I think what really matters is the aftercare. If you are not careful afterwards, it can result in infection, and I know you don't want that. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you the aftercare for circumcision. Aftercare for circumcision. I'm going to be sharing this particular topic not as a midwife, but as a mother. Yes, not as a midwife, but as a mother, like as a mother taking care of her child. All right, so that's what I'm going to be sharing with you today. First of all, let's talk about the different types of circumcisions. So for circumcision, depending on your circumcision specialist, some can use the plastibell. Plastibell was what we used as midwife in Nigeria back home. Some can use the Gumco clamp, which they used on my son, and some can also use the Mogen clamp. So it all depends on your circumcision specialist preference. All right, but for mine, they used the Gumco plank to take away the foreskin, and the whole place was reddish. So on that particular day, what the circumcision specialist advised was that we used 2 pampers throughout. This is to avoid friction on the penis, like avoid pressure and avoid the legs from coming together. So you're kind of splitting the legs. So they advise you use 2 pampers on that particular day. Aside the pampers, you are also expected to have a lot of Vaseline or pseudo cream in the house, because that's Vaseline or pseudo cream. You use it to cover the top of the penis before putting the pampers on top to avoid unnecessary friction and pressure on the surgical site, which is the penis of the baby. All right, so that is what you're expected to do throughout that first day, nothing else. Use 2 pampers whenever you change the baby. Make sure that the baby is on 2 pampers, not just 1, and also put enough Vaseline on the glands of the penis when you change it. I notice that the Vaseline usually dissolves before the next pee or the next poo. So after day 1, we now go to day 2. That's the next day after the circumcision. The next day after the circumcision, we are expected to use the salt water. He told me to use the salt water. Remember, I'm talking as a mother and not a midwife, okay? So I'm following the instructions I was given. Yeah, he said we should use salt water baths on the child. We can do it once or twice daily. That's, you are not washing the full body, you are just practically washing the down part, the penis area, because he believed that it helped with wound healing. But there are some school of thought that says that salt in water is not necessary. Okay, but he said that we should do it. He is the circumcision specialist. He knows why. So that's why I said it is advisable for you to follow your circumcision specialist instruction. But I'm just sharing my own. I think with the salt and water, it actually helps with the healing because everything is healing really fast. Okay, so that's the second day. So I was using salt and water morning and evening to actually clean the area. And on the second day, you are no longer using 2 napkins. You're using just 1 napkin. Okay, and remember, before you put the napkin on, you have to apply a lot of Vaseline. So if you are going for circumcision, you have to apply Vaseline. You have to have plenty of Vaseline in your house because that's what you'll be using over time to actually prevent friction or coming attraction between the pampers and the penis. So that was the aftercare, using salt and water daily, trying as much as possible not to get the penis actually infected. And there are some things you are going to notice. You're going to notice redness. You're going to notice swelling, which is normal. And you're going to notice some whitish, yellowish, like greenish discharge around the penis or beneath the glands of the penis, which is usually normal. It's actually shows that, okay, it's healing. It's part of the healing process. It is known as sealant. It's part of the healing process. So those discharges are similar to what you have in your umbilical cord of your baby. It's similar to what you have there. So it's part of the healing process and it's not something you should be concerned or worried about. But if you are worried about anything, always consult the specialist, the person that did the circumcision. So he said it's not something to be worried about, but if I am concerned, I should also let him know. So I continued with this procedure over time. Personal hygiene is also very, very important. Personal hygiene, please and please take it very important. So when you wipe, you try as much as possible to wipe properly, and you don't clean that sealant, that whitish yellowish discharge. Don't try to clean it. Don't try to remove it, because that is part of the healing process. If you remove it, you are going to do more harm to your baby than good. And if peradventure poo tends to get to the glands of the penis, what's advisable for you to do is to take the little wipe and dab it. You don't put pressure on it, trying to like clean it forcefully. You dab slowly to take it out. You don't put pressure, because it's going to hurt the child and it's going to cause more harm to the child. So before I go, I would like to share something very important with you. And that is when you need to call the circumcision specialist or your doctor as soon as possible. If after circumcision you notice your child is having fever, signs of infection, your child is having pain, your child is finding it difficult to pass urine, it is very, very important for you to call the doctor. Or the child is bleeding. Bleeding is not expected. Redness around there is expected. Swelling around there is expected. But when you notice your child is bleeding profusely after circumcision, it's very important for you to call the doctor. If you notice high body temperature, your child is hot, your child is crying uncontrollably, it is very important for you to consult your doctor or the circumcision specialist to know what to do next. So this is what I have to share with you in regards to the aftercare and what to do in terms of circumcision. All right, so thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.